one and all. Let me check my sound is going in. It is fantastic. Thank you very much for being here. Hello, everyone. If you're here on a live show, really appreciate it. If you're watching this on catch-up, fantastic. Good for you. Hope it's useful prior to your exam. This is a session all about OCR Sports Science R180 unit for summer 2024. Now, interestingly, this is not the only session I've done in 2024 for R180. I also did a session in January for those studying the January exam. So if you find this useful, it's a really good idea to take that session as well. There are a couple of overlapping sort of content areas and skill areas, but actually, excuse my tinkling in the background, there's quite a lot of fresh content in both of them. So, it might be useful if you take both if you find one of them useful. Now, with regard to this afternoon, a couple of things. I'm expecting the sort of the taught element of this session to be around about an hour and 5 minutes, something like that. And then what we're going to do is we're going to obviously have a bit of a chat right now, which is what's happening. Then I'm going to teach the majority part of the session. Then we're going to have a little break, see if there's any questions that have come in, and then we'll do the second part of the session, in which case we'll wrap it all up. And I'll come back on the screen at the end and just say me thank yous and me goodbyes and anything else that people want me to say. And we shall go from there. Now, in terms of taking the session this afternoon, you really, really, really need to be taking the session in combination with the published notes pages that go with this session. If you don't do that, you are not taking the session as it's designed to be taken. So if you haven't got the notes pages yet, they're just in the descriptions below or on the hub page. Secondly, to the notes pages, perhaps even more important than that, maybe not concurrently with the session, but alongside the session, we've published a national mock exam, a national mock exam mark scheme, and also the model answers for that exam. And I urge all students to go and study and learn those. We did exactly the same for January. So you have 2 full papers, 2 full mark schemes, 2 full sets of model answers. Please, you really need to, I sort of I almost want to force it onto you somehow. I want you to go and take that, because we really believe that's going to be a very, very impacting experience for people if you take that in preparation, use that material in preparation. Now, and I know it's not an exciting thing to say, guys, but you really need to learn those model answers. I don't know how else to say it to you. You really need to see the language and the mark schemes. You need to do that, okay? That's how you prep yourself and sharpen yourself for that assessment that you've got coming up. And by the way, that applies to all courses. Now, other things, we have a chat page available to you. If you're on the hub page, we've got a live chat. It's just down in the bottom right hand corner. Click on there. I normally have Marta with me, sat right opposite. She sort of co-hosts these events with me, but unfortunately Marta, well, not unfortunately, she's gone over to Spain to see her family. So she's over there. If you're watching, Marta, I'm just going to say, you're meant to be at lunch with your sister, but I'm sure you're probably keeping an eye on things. So just me in the studio this afternoon, but hopefully this is going to be really useful. And finally, guys, if I could ask a favour of you, if you could please like the video on YouTube, if you could also offer a subscription to subscribe to the channel. We're trying to get the channel subscription beyond 15,000 subscribers this revision period. Now, we put this material out completely freely, and we think it's useful, and therefore we'd like you to support it. So without guilt tripping you too much, ding that button and give us the opportunity to have a little bit more popularity on YouTube, and that would be a nice sort of cyclical positive vibe. I don't know what that sentence even means. Last thing before we jump into this, guys, as I change from this camera view to my canvas view, what's going to happen is I'm also going to change microphone, so you might just need to adjust the volume based on the microphone you use now, and then the microphone I'm going to be using for the canvassy bits. So just be aware of that. There will be a switch. Otherwise, I think we are red hot. So I think I'm going to line up my canvas, but I'm going to grab my digital pen, and we're going to jump in to R180. Here we goes. Fantastic. Okay, let's get on with R180. Couple of things. First of all, you really need to have the notes page in front of you as I go through this session. Can I also stress to you, and this goes to everything in this list, can I just mention to you that I also did a session in January 2024, and there's lots of other content in that one. It's completely free and available on YouTube, on our hub page. I believe from the 2024 summer hub page, if you're on there, there is actually a link to the January sessions. If you were to consider that what we're going to cover here, I'll get to in a second, plus that session there, which has got its own national mock exams, got its own notes page, its own infographics there, same. It's got its own mark scheme model answers. I'm not sure how much more someone could be prepared than to take those two sessions in combination. I mean, if you do that, students, you're going to absolutely walk this exam, bluntly. So it's a really, really nice model. I'm not suggesting that our 2 revision sessions cover everything on the course, but it's a huge amount of what's on the course. I'd have to check exactly to see what proportion, but it's significant. Secondly, folks, the exam infographics are there. These are based on the SAMs, the sample assessment material, so please bear that in mind. It's only an indication, but we have published a full national mock exam, the mark scheme to go with it, and model answers that fulfill the requirements of that exam that's available for you to read, to learn, to mark, to discuss, to do as classroom-based sessions, teachers. They're there for you. And again, just to repeat, all of that for Jan 2024 as well. Now, with that in mind, this is what we're going to cover in the section. Now, again, if I was to, maybe I will in a minute, but if I was to have a look at the January 2024 section, the whole first bit is about extrinsic factors. So if you look here, we're going to do a bunch of intrinsic factors in this one, individual, psychological. But of course, in the Jan 20, we've got all of the extrinsic factors covered as well. So it's a really, really interesting one for you to to look in combination. And the point I want to make more than anything, as well as saying we're going to cover these 10 topics, is to say very, very simply that what we're going to do here is we're going to look at exam skills as much as we can, actually progressing and developing these ideas, these base concepts, and taking them further so that we're able to perform them. Okay, with that in mind, let's move straight into intrinsic factors and individual variables. Now, you've got a bunch of things here. Now, obviously, you might get a question which is naming a bunch of these things. Maybe that's a nice simple opening that you can get access to. But what I want to do is I want to develop off the back of these. So let's just go round as the clock, as it were, starting at 1 o'clock gender, and start to talk about. Now, when we talk about gender here, I am making no distinction between gender and sex. Please note that what I'm talking about here is not political in any way, shape or form. Okay, so when we're talking about male and female, a couple of the key things here that you will find in sport is you've got no male versus female combat. Okay, so think about judo, think about MMA, combat sports. So we would not have competitions between those two. I think, for example, it may well be, I'd have to check each individual sport, but below a certain age, below 11, below 10, before the more dramatic impacts of testosterone through adolescence, that may well be different. But I'd also say about contact sports in general are worth looking at. Now, there has been a history that contact sports have been kept separate between males and females. That is now being questioned, and I know, for example, the rules about girls and boys playing football together beyond the age of 11 have changed recently, so that's something which is constantly in a state of flux, and I suppose constantly open to new scientific understanding. With regard to age, I want to make a couple of points here. We must have age-appropriate groupings. Okay, so I'm pretty confident there's people taking this session that are in under 16s, that are in under 17s, that are whatever it might be, that are in the youth team, etc., etc. When we look at sports groupings, we often look at age-appropriate groupings that way. We have no children versus adults. Now, I've got my own little history with these things on both sides of the coin. I was once involved as a student in students versus teachers football match. That was a very bad idea, and I nearly got myself into heavy trouble. And I then, as a teacher, played in a teachers versus pupils basketball match, and a boy broke his nose. So this is something that you really want to be careful with. Okay, so we don't want that. Now, we also want to stress this point that young bones, that sounds weird, young bones are not fully ossified. Now, if you're interested in the process of ossification, I've got whole tutorials on that, and the bone matrix, and osteoblasts, and class, and osteocytes. Anyway, it doesn't matter. What we're saying here is that younger bones are not fully formed yet. Now, the epiphyseal plates, or the growth plates, are a significant part of that. We may touch on those elsewhere. And we can also argue that older bones, more susceptible to fracture. Okay, so I'm 47, by the way. I know it sounds really old to you. It's quite old, really. But what we find is the bone matrix actually decreases. Its calcium, the calcium storage of the bone actually decreases after in middle age and beyond. And by the way, this is really closely linked with things like menopause, for example. So that's something you might just want to have an awareness of. Now, with experience, it's very simple, really. We're talking about, that was meant to be a different colour. We're talking about the amount of experience a person has got. That will lead to all kinds of different things: skill level, fitness level, tactical understanding, etc., etc., etc. With weight, this can be an intrinsic factor to injury. Now, a couple of things we basically want to say. There are many exceptions to this, but more weight
would tend to lead to increase their arrows, by the way, chance of injury. Now, that is a massive generalization, okay? But it's something I want you to think about. Think about things that we might be talking about here. We might be talking even about chronic injuries, things like joint strain, knee strain, etc., etc., etc. These might be factors to be considered. But also, this is not always the case, right? It's not always, I mean, think about sort of really low weight conditions. Think about certain eating disorders or significant weight loss. People would be more partial to, obviously, injury in that situation. Let's have a look at an example of fitness levels. Can I stress again this example? What about someone's amount of flexibility? Think in your sort of surroundings. Maybe it's you of a really kind of dynamic, powerful rugby footballer, boxer, this sort of character, okay? If they are not flexible, there's a really, really solid opportunity of injury there, okay? So this is not just about being able to run for miles, but other components of fitness as well. Now, technique and ability is a really important one. We could be talking here about chronic injury. We could be talking, I'll give you a couple of examples. Someone with questionable technique might develop tennis elbow. They might develop ITBS, iliotibial band syndrome, which is pain on the outside of the knee running up to the hip for people who are runners. We could also be talking about back problems. Someone who's got sort of, think about a tennis player who's serving very regularly but has got poor technique and is sort of arching their back incorrectly. That might lead to sort of lower back issues, for example. I think nutrition and hydration sort of self-explanatory, but let's just go through these. Think about like hydration. One of the things we know about dehydration, whether that's hyper or hyponatremia, doesn't matter. What we find is that it has problems it causes issues of impact on concentration. So what we might find is that someone who's dehydrated might be more prone to errors, poor decisions, and they're therefore more prone to kind of injuries type situations. Also with this, we might be talking about let's call it a lack of macronutrients. Now, there are all kinds of conditions related to this, by the way. There's one that you might want to look up, which is called LEA, which is called low energy availability. It leads to something called REDS, it doesn't matter. But lack of macronutrients, I'm talking about carbohydrates, fats, proteins. What this can often lead to is lethargy. Now, that's a nice word for you to build in. This is tiredness, fatigue, and again, that could lead to poor technique, poor decisions, etc., etc., etc. It might also influence things like fitness levels, which might decrease as a result of that. Right, medical conditions, I mean, we could go into all kinds of things here, but I'll mention, for example, epilepsy could be a determiner of what kind of activities that a person might engage with. Type 1 diabetes, although that's absolutely manageable, might have an influence on certainly how things could be done. Then with sleep, things we're looking for here, if we consider lack of sleep, again, we might be going into poor decisions, going into scenarios where injury is more likely. And the other thing, so that's the negative of sleep. Let's go to the positive of sleep. If people sleep well, this is when the adaptation process happens. So adaptation is the physical process of becoming fitter. For example, let's just air quotes, muscles getting bigger. I'm not going to get into hypertrophy and so on, but adaptation occurs while we're sleeping in the majority amount. So the better and the more sleep. And by the way, this is not just about amount. This is also about quality. You've all got this on your phone, I'm sure. But things like quality of sheep. Where am I going with that? Anyway, quality of sleep. This actually, the ratio between what we call REM and non-REM sleep is actually really, really important. And then previous recurring injury. I mean, it goes on. One of the things I would say here is about the way of returning, which sounds quite philosophical when I say it like that, but think about someone that suffered an ACL or suffered a broken ankle or things like that, is if they don't return correctly, the chance of injury again is really high. And by the way, the example I have seen this again and again and again and again in teenagers. For example, ACL reconstruction surgery. Oh my God, it's been really difficult. Get back, push it too quickly. First twist and turn, boom, and it goes. That's something to really be aware of. Now, I'm not criticising, I'm just stating my experiences. Super quick break, I need to cough. the structure of our thoughts and our feelings can also impact injury. So remember, we are looking at whether injuries are in there. Injury is more or less likely because of these factors. Now, I'm going to start with arousal, even though on my list motivation's top. I'll come back to that one. But I'm going to take my time on these, so I want you to really get into note-taking at this part for me, okay, folks? So with arousal, what we're talking about here is a physical and psychological state of alertness. So it's kind of how awake we are, how ready we are. I like the word readiness when I think about arousal, how ready we are. And one of the best theories we have to describe this, well, I say best, lots of people would criticize it, is that inverted U theory. So I'm just going to sketch it for you. What we have in the inverted U theory that I'm going to present to you, okay, what we're going to have here is that arousal is increasing. Arousal is increasing along the x-axis that way. So obviously high arousal, low arousal, for example. And what we've got here, I'll just change color. What we've got here on the y-axis is we've got performance quality. So obviously the higher up this goes, the better someone's performing. Now it's actually a theory by someone called Yerkes and Dodson, or two researchers. What Yerkes and Dodson argue is that best performance, which obviously we're going to have somewhere up here, there's our best performance, right? It happens at what we describe at moderate arousal level, something like here. And that either side of that, we get a decrease in performance quality. So Yerkes and Dodson argued for this type of relationship between arousal and performance quality. Now, obviously, the point would be that if we are not at optimal arousal here, okay, optimal arousal would be this level of arousal, then obviously if we're here, for example, our performance quality drops a lot, and as a result of that, we may experience injury. Or if we're under aroused, our performance quality technique is going to drop, and we may be more prone to injury than we would be when we're performing our absolute optimal over here. So there's a relationship between arousal and performance quality, but also there's a relationship between inappropriate arousal and the possibility of injury. Now, just a couple of points I want to make to you before we move on from this. I just want to stress here, this is what we call the optimal point, okay? Optimal point, that's there, okay? And that is this level of arousal. We get best quality performance here. But other things I just want to stress to you, this is what we would call under arousal. So green is under arousal, and the point we're trying to make here is that this is not going to lead to best performance and might be indicative of a scenario where injury might be possible or more likely, and that this obviously is over arousal. Now, I'm not going to get deeply into this theory and how it's changed. I've got a whole playlist on this theory, actually, funnily enough. But the point I want to make is this one. What we find here is that especially with underarousal, we get the possibility here of underperformance. But with overarousal, especially in relation to poor decision making and missing relevant cues, injury likelihood goes up as a result of that. So look out for that theory. It's something that it's useful to be aware. But by the way, sometimes we call this boredom, and sometimes we call this panic, if you want to call it that, or hypervigilance. Anyway, that's just for you to be aware of. Let me jump back to motivation now. This is the desire / determination to succeed. Now, that's an interesting statement to me, because in my other reading, I also know that it's something we do. Motivation can be really driven by avoiding failure. And I'm not going to get into too much here, but we're going to consider desire, determination to succeed. Now, two forms of this. We are talking about intrinsic motivation. Think about fun. Think about, that's meant to be an F. Think about pleasure. You go and participate because you love what you're doing. Think about things like achievement. Sense of achievement is a really nice reason that someone might go and do that. But there's another form of motivation which we're going to refer to as extrinsic. Now, this is where things can get maybe a little bit more interesting, maybe a little bit more questionable. When we're talking extrinsic, we're talking about things like rewards, and these can literally be tangible, not just praise, for example. These could be things like money. And how many times have you heard people say, right, you've got to put your body on the line, or it's a big game and someone's thrown themselves into that big rugby tackle or has blocked something or whatever. The idea of that is that motivation can lead to a sort of a potential where injury might be likely. And we might argue that top level sport, that sort of extrinsic rewards and the perceived importance of outcomes, especially when they're things like especially when we're talking about things like professional sports and money, then those things kind of obviously lead to questionable safety decisions and air quotes putting someone's body on the line. Now, with anxiety and stress, we want to think about negative thoughts. Okay, negative thoughts, negative thinking, intrusive thoughts, negative thoughts. We call it worry. We call it apprehension. And the idea here is that if someone's very anxious or stressed, it could be that they make questionable decisions, that they're not feeling confident in a particular scenario, maybe go into something half-hearted. Injury might be more likely. Nice tea. Okay, let's think about confidence. What are we talking about here? Well, it can be both global in the sense that people can be high or low confidence about all kinds of things, or it can be specific. You know, for example, I played football my whole life. And, you know, some people are really confident and less confident, like heading a football, for example. And I've seen people who are really, really confident go and do that and have no issues with it. I've seen other people who are kind of like less confident with that particular skill set, you know, and they might sort of tuck their neck in and catch an elbow, not rise high enough, this sort of thing, and be prone to things like injury. Now, I want to talk about direct aggression and what we mean by that. We must differentiate this from other kinds of aggression. We're talking here about physical contact with another performer. I'll just put with another. Okay, so obviously in boxing, this is striking someone, for example. In rugby, it's tackling someone. But it wouldn't be a badminton player hitting the opponent with a shuttlecock. That would be indirect aggression or channeled aggression, okay? Now, why might physical contact happen? It's typically to gain an advantage. Obviously, sometimes it's skill-based, clearly, but it would often be to gain an advantage. And this is the interesting one. Our example would like us to say that this is often outside the rules. I think the word often is important there, often outside the rules. So we're now spilling into things like striking an opponent, kicking an opponent, throwing an opponent when that's inappropriate in one's performance. Obviously, that could become injury-based as a result. Now, another point I want to make is obviously we've got channeled aggression, okay? Channeled aggression. So make sure we understand the difference between these two. This may not involve contact, so it's not, you know, literally hands on someone or whatever, not involve contact. And what we might find is something like intimidation behavior. Okay, intimidation, you know, tennis player striking their smash at their opponent, for example, body serve, for example. But typically, these actions are within the rules, okay? Within the rules. Bodyline bowling in cricket is another good example of that. Sorry, I've just realised what I've done. Direct there, channel there. All that can go into there. Sorry, folks, I was going to give you another one. So there we go. Okay, let's move things forward. Lots of detail there. Let's look at our physiological and psychological benefits of a warm-up. First of all, I've put the phases of a warm-up here. What I think you guys should be able to do here is to apply these things. So if you're given a scenario of a gymnast, a rugby player, tennis player, a triathlete, you should be able to say what might be the types of things they do for this. So for example, let me choose a random athlete. Let me go for something like, let me go for a swimmer. Okay, I'm going to choose a swimmer here. That's not that random, but you know what I mean. What are they going to do? Well, they're going to do 200 meters in lengths. They're then going to do some. Mobility, arm circles. They're going to be doing some hip stretching. They're going to be stretching out the fingers and the wrists. They're going to be doing some neck rotations for breathing, etc. Then they're going to do some dynamic stretching. So in this what they might do here is they might put a leg float between their legs and focus on arm stroke really, really slowly, but really stretched out, for example. And here they're going to go and do some dive start practice and do some tumble turn practice, for example. This is what we might be talking about. My point is that I've applied that to my swimmer. Can you apply it to a football player? Can you apply it to a netball player? Can you apply it to a javelin thrower? Okay, that's what I would be suggesting is the skill there. Now let's take things further. Physiological ultimately means physical in this sense. There's a bit more detail to that, but let's go with that. What are we expecting? Well, okay, muscle temperature goes up. This really, the key thing I want to say here is that pliability, and the word I like to use, extensibility, they increase as a result of this. Pliability and extensibility increase. Okay, so that's really useful in terms of body temperature or muscle temperature. Also, by the way, a little bit of increased muscle temperature is actually really good for getting more oxygen out of the blood into the muscle. It's called the Bohr shift. It doesn't matter, but it's something that you just want to be aware of. We also get an increase in heart rate. That means we get an up arrow. We are now getting I wrote it twice, an up arrow greater delivery O2, but we're also getting up arrow greater removal of waste. Okay, so think about whether that's things like carbon dioxide, that could be things such as breakdown of lactic acid, which doesn't really matter, but we can ultimately breathe out in the form of CO2 and water, anyway, in water vapor, but we'll come back to that perhaps in other studies. Increase in flexibility in muscles and joints, I mentioned that over with pliability and extensibility. One of the things I think is really nice here, and links to the next one, is we get increased temp of something called synovial fluid. Now, don't worry too much about that sort of technical term. What that is this synovial fluid is in the joint. So when it gets warmer, it gets a little bit looser, more lubricating, and that allows the joints, firstly, to move through a greater range of motion, but also to do so nice and smoothly. Increase in pliability of ligaments and tendons, exactly the same point. Remember, your ligaments stabilize joints, your tendons transfer or transmit force from the muscular system onto the bones. We also get an increase in blood flow and oxygen to the muscle. I've touched on that over here. By the way, there's loads of ways this happens. One of the ways that this happens is called the redistribution of blood. And what happens is that when we're at rest, as you're presumably sitting where you are now, about 80% of your blood is not going to your skeletal muscles. But when you start exercise, 80% is shifted, so it is going to your skeletal muscle. So just bear that one in mind. And also we get an increase in the speed of muscle contraction. There's a lot of layers to this actually. This actually includes the transmission of the nerve impulse to the muscle contraction as well as the muscle contraction itself. But I won't get into that now. So those are all the physiological benefits. Where we need to be a little bit maybe savvy is on the psychological benefits of what might be relevant to us. Let me make sure I'm going to get these with the right icons, okay? So I'm going to say we're going to get here heightened arousal. Now bear in mind, according to Yerkes and Dodgson, we are aiming for moderate arousal. That could be good. We might get an up arrow, an improvement in concentration. Fantastic. Selective attention, cue utilization, better focus. Fantastic. We might also get here an increase in motivation, the desire or the drive to succeed, or again, avoid failure. So we feel more driven because we have taken part in that warm-up. Therefore, the chance of injury decreases. We might get an increase in confidence, again, and therefore better decision making as a result, as long as it's balanced. And finally, folks, we might have the time to experience mental rehearsal, playing through aspects of performance or things that need to be done before they happen psychologically in the mind. Why? Because the subconscious knows no difference between the reality of our world and the imagined reality. Therefore, if we mentally rehearse as far as your subconscious has been there, affecting things like confidence, affecting things like motivation and concentration, as a result of that rehearsal, we've technically, as far as the subconscious knows, is we've really experienced those things. Okay, so quite interesting that, isn't it? Quick brief pause there for acute injuries, and I'll be back. Let's remind ourselves about acute injuries by quickly defining what they are. What's happened to my pen there? We are talking here about some form of sudden trauma. And notice the word sudden there. Obviously, this is what acute means. And the other thing we'd say here is it causes immediate, there's two M's in there, immediate pain. Okay, so this is about immediate pain, about suddenness. So notice those two sort of, I suppose, temporal descriptors of time. Now, with that in mind, we're going to go through a whole bunch of different acute injuries and make sure that we're comfortable with them. So first of all, I want to talk about... Oh, hang on, that's not the... I was going to talk about strains, and I've just realised that I've got things in a different order here. Hang on a minute. That was not what was meant to be. Let me get that off there. In fact, I am going to do strains first, because I've got it first on my document. So I'm going to do strains first on it. Okay, so here's me strains. So first of all, what's happening here? Well, we're talking about a torn muscle, okay? And the other one I'm going to say here is a torn tendon. Now, when I say tear or torn, obviously they can be of different severities. Okay, so you could also be considering this almost like a pulled muscle. But the thing I want to say here is that these are often sheath injuries, not in that way. What we're talking about here, if I was just to quickly draw a very rudimentary muscle, so here's a muscle going down to its tendon, here's its tendon down here, look. Okay, what's happening with this muscle? Where's my colour gone? What this muscle is, my muscle here. This muscle and this tendon down here is surrounded, by the way, not by a green, it's surrounded by a sheath tissue. Okay, the sheath tissue which surrounds the muscle like this. It surrounds the muscle and the tendon on the other end. Let's put my tendon up there on the other end. I think I've got the wrong colour, but there you go, tendon on the other end. But that sheath around there surrounds both the muscle and the tendon. And if that sheath gets a little nick in it, or it sort of splits or becomes frayed, which literally, that's what we would call a strain. Notice I am not talking about a ligament. We're talking about the sheath tissue around a muscle and or a tendon. Now, what's going to cause this? We are talking about no down arrow or lack of warm-up. That is a classic example of when this is going to be done. Other things here, oh sorry, I should have gone here. Warm-up, oh my God. Other things here, too much overload, okay? So our overload, increasing training is not progressive, it's done too much. So too much overload. Now, obviously I need to do the treatment because I didn't do my columns correctly, but the treatment over here, folks, what would we tend to do? We would tend to use, and I'll do this better from here forward, ice pack. We're talking about rest, okay, and we are talking about stretching. These are typically things that would be done to treat this particular type of injury. Now, we've also got here, if I just go down here, we've also got here at the ankle, we've got the idea here of a sprain. Okay, so I'll go down to this one, a sprain. Obviously, we might mix these up if we're not careful, but we are talking here about a torn ligament, not muscle, not tendon. Think about an ACL injury, for example. What are the causes of this? Well, typically, it will be things such as twisting that will cause a sprain, a twisting, a dynamic sport injury. We might get foot stuck, foot stuck in the turf is a classic example, or even on the astro for hockey players, for example. Now, how are we going to treat this? Well, we're going to use ice. We're definitely going to use taping and bracing. Okay, so as we return back to performance, sometimes after quite a long time, that's going to be the case. We definitely want rest. And the other thing is when we return, we want to be returning to non-dynamic movement. So let's just say we've got a strain of the ankle ligaments. When we first return, we might be doing swimming, cycling, we might be doing walking, jogging. Why? Because they are in a straight line. They do not involve twists and turns and zigzagging, which is what we'll get back to later on. Okay, let's go back to where I should have started. Up here, we have got skin damage, okay? Skin damage. That threw me seeing that image there. I thought I was going to do strains first, but I did. So what could we be talking about here? We're talking about abrasions. These are also referred to as grazes. Abrasions, grazes. We could be talking about cuts. Cuts are also called lacerations. Oh, what a word. Lacerations. Contusions, another one. Now, contusions, technically these are not skin damage, they just show through skin. That's a bruise. And then finally we'd have something like blisters. Okay, that's damage to the skin for rubbing of, whether it's a tennis racket onto the fingers or whether it's a shoe on the back of the heel is a classic, isn't it? What do we cause these through? Typically impact. Think about things like falls, for example. It could be, especially with blisters, it could be wrong footwear or ill-fitting footwear, or new footwear even can sometimes cause that. It happens to me all the time. The other one you want to be thinking about, and why I hate this word, I always spell it wrong, jewelry. One of my problem words, does my head in. So what do we treat this with? Well, we want to wash it, okay, to clean the affected area. We need to do that. We need to use stitches or sutures if that's required. And the other one is that we need to expose to air. Okay, so we need to expose to air. Now, I'm not going to get into the role of platelets and fibrinogen in the blood. That's for a whole other conversation, but they actually work it through contact with the air. So that's something to be aware of. Now, let's talk about fractures next. Okay, let me get a nice brown colour. Don't often hear that being said. we're talking about fractures here. What might we be talking about? We might be talking about an open fracture. That's when the skin is broken. We might be talking about a closed fracture or a simple fracture. We could be talking about other kind of fractures. There's all kinds of things. There's spirals. There's green stick fractures. I'm not going to get into it here. The other one I just want to mention is a stress fracture. Okay, a stress fracture. Stress fracture is typically a chronic injury, so we're not going to consider that too much here because we're talking about acute injuries. What's going to cause these? We could be talking about impact again, like collision between a hockey player's leg and a hockey stick, I suppose, would be an example. We would also find that twisting, especially at the ankle, is going to be an often cause of something like a broken ankle, obviously. So what treatment do we need? Well, first of all, this needs to be medically done, medical attention. Now, I've actually seen some of the horror stories from being a PE teacher. I've actually seen people try to address broken bones in the wrong way. It is not a good idea. Do not mess about with it. Immobilised and set a cast. And, of course, that's going to be done in the hospital or whatever situation you are in. I'm not totally sure why we've got two broken bones here. What's that one meant to be representing? I don't know, so I'm going to come back to that one. Now, what I'm going to do here is I want to talk to you about dislocations. So let's go to a nice purple. Dislocations. That's why we've got a shoulder here, because it's a bit of a classic, in it, a shoulder dislocation. So let me put in shoulder would be pretty common. I've seen an elbow dislocation before. It was absolutely ridiculous. What's going to cause a dislocation? Typically an impact, typically a fall. Okay, that's what's going to cause the ball to leave the socket, right? That's what's going to happen. Right, how are we going to treat this? Again, I have seen loads of people not do this. Medical attention. Do not put a dislocated finger back in, folks. It is not good practice. So medical attention. Do not replace joint. Now, obviously, it depends what you mean by that. But don't do that. It is not a good idea. Please don't do that. Gas and air. This happened to me. God, I remember that. Good stuff, though. Before being placed back. And the other one we really want to get into there is rest. We want rest in that situation. Now, we've also got here concussion. Concussion, obviously. Concussion. Now, can I remind you, concussion is when the brain rattles within the head. Okay, so it's a rattles the brain. So the brain actually impacts the inside of the cranium. There's actually a protective surface in there, but that's obviously a bit of an issue. And we've got issues in here because it increases early onset dementia and Alzheimer's. Okay, so there are issues with concussion. Now, I don't want to get too heavy on this, but I've actually done a lot of my study and research around concussion and its relationship between multiple concussions and successive concussions and behaviour changes. And it's not my place to say. You can look at certain cases and really wonder, did someone's extreme behaviour come from multiple concussions? But I think it's an interesting question to pose. Other things we want to say, crashes are a good one for that, things like motorsports, equestrian sports, things like that. Now, how do we treat this? Well, we must use a HIA, a head injury assessment when it happens. We must use removal. That's absolutely critical. We must use rest. We must be monitored, okay, because obviously symptoms can deteriorate. And do not rush back. Okay, you do not want successive concussions. Okay, that is not healthy. Again, we could go into that, but I will avoid that just for now. Okay, where are we? I think not quite. Common injuries in sports. So again, I just want to sort of summarize those for you there. That obviously we're looking at the type, we're looking at the cause, we're looking at the treatment. Okay, pause there. Acute injuries alone. I just want to talk about the 6 R's of treating concussion specifically. So this is a process, and remember, we are going to use a HIA, a head injury assessment. And something I wrote recently was in relation to how infrequently these are done in sports like association football compared to other activities. It's actually quite remarkable. But anyway, I'm not going to get into that here. It's not the day for it. Anyway, 6 R's. This is how we do. We notice the signs of concussion. Okay, because this could be uncertainty. Well, it's definitely going to be a period of unconsciousness, even if very, very briefly. It's going to be confusion. It's going to be short-term memory loss. What are we going to do? We must remove the athlete if we experience that. We must get them through referral to a medical support. They must rest until they are symptom free. We then want 1 to 2 weeks recovery before they're allowed to return, and then we want a graduated return. Okay, so introducing activity again gradually. Now, I'm going to tell you that this is not done anywhere near enough in sport. Now, again, I don't want to get too dramatic about this because we're preparing for R180, not my little political agenda. But this is something that really, I guarantee you, this is going to be in the news in the coming weeks and months. I guarantee it, and you're going to notice it because this is going to be a really big hot topic as we go forward, and rightly so. Okay, super quick stop. A classic example of how we're asked about safety checks is we'll be given a scenario or a location. We need to have an awareness of the possible risks and injuries associated and what the control measures might be best for that particular scenario. So let's have a bit of a think about that. We've got here sports hall. We've got badminton, tripping over benches too close to the playing area. How do we mitigate or control that risk? Check the playing area is clear of any trip or hazards. This is probably the umpire, depending on what we're doing. This could be the coach, could obviously be the players themselves. Okay, what else have we got? Possible injury, sprained ankle, skin damage, cut to the knee. So we could have a twist, a fall. Make sure the participants have suitable footwear. We might go on to say first aid kit. Now that does not prevent what's going to happen, but perhaps we can be better at treating that. Okay, what about this one? What about collision with wall? Okay, the possible injury here would be concussion. So what are our control measures? Enough runoff space. Another one might be warning participants of the possibility. You might even go for rule changes such as non-contact, no types of certain tackles, no types of certain occurrences you might go for. Let's move on to Astro. What have we got here? A poor tackle leads to a player being hit with a hockey stick. So what might happen here? Well, we could have a cut, we could have a fracture, but what have we got? Check all players are aware of the correct technique when tackling. Make sure the players are wearing protective equipment, e.g. shin pads. So I'm going to say here, possible injury, I'm going to say here, contusion or bruise. Okay, that's what we mean by contusion. Okay, so that's perhaps what, someone's going to get bruised and injured that way. What else? Let's go for this one here. Let's look at others for Astro. I'm going to talk here about foot gets stuck in Astro. We could be talking here about a sprain of an ankle. Okay, for example, how would we control that? Water or sand, the Astro, so make sure it's properly maintained. We want correct footwear. And we might also say here, again, this does not control measure, but we might have some kind of first aider or kit. Now that's obviously responding rather than preventing, but it's something we might want to be thinking about. Let's go further. Right, field. What might we be expecting would be a risk here? So why don't we go for uneven surface? Okay. What might be the risk here? We might have a fall leading to concussion. Okay, so someone might experience that, for example. What might be our control methods for this? We might monitor the surface, like some kind of check by the referee or coach beforehand. So we want to monitor the surface. Secondly, if we've got multiple pitches, we might want to rotate pitches. No, I don't want to encourage this, but we might want to cancel or relocate certain fixtures depending on obviously the severity of that particular injury. Now, I'm going to go for this one. So a field here. Okay, again, same sort of idea. Obviously, we could look at various things on this one. I'm actually going to say here, extreme low temperatures in winter, for example, and if we're on the grass. What's the possible injury? Well, it could be a hard fall onto ice, it could be a slip because there's ice, but I'm going to say here, I'm going to just use the term exposure, or we could say hypothermia. Hypothermia, by the way, I said there. Okay, so how would we control that? Pitch inspection. Temperature rules. So obviously if it's below 0, whatever, I'm not saying exactly what the threshold should be. And finally, you might have something like appropriate clothing, especially things like substitutes, warm-up jackets or whatever it happens to be. Or, you want some kind of heated space that people can go to warm back up. Maybe it's the inside area. Now, a couple of things. You may get a specific question about how to avoid acute injuries in PE lessons. So think about a PE teacher. I guess I don't want to speak for anyone here, but there's certainly going to be PE teachers paying attention to this. Some of you maybe taking this lesson might be looking in that direction for a career. So what might we think about here? Well, warming up is a classic. This is, just to be clear, this is every lesson, no exceptions, folks. Maybe they need to be more significant in the winter and cold weather and so on, but every lesson. We want good technique, and this is not just about performing. This is also about lifting things. Think about gym box tops or goals or things like we want to be lifting, and we want to be and let's go for also support or spotting of one another. Okay, that's a really good one. Staying within the rules, obviously, that's going to help prevent injuries. Progressive overload. Remember, progressive overload should always be gradual and steady. We don't want to just send kids out on a 10-mile run because it sort of gives us a chance to have a coffee. No, we want to make sure that it's gradual and steady in that particular case. Okay, lifting and lowering correctly. I've just touched on that one earlier. Could be in performance or out. And following instructions, that's really important. And you'll notice, think about things like, have you ever been in a javelin lesson and someone doesn't listen to the PE teacher and lobs it at the wrong time or collects at the wrong time or runs to collect or whatever or carries the wrong way? Stuff hits the fan, doesn't it? Because teachers are very aware of the potential significant safety considerations. Okay, brief pause there.
There we go, folks. Oh, let me turn my headphone sound icon off there. Good stuff. I looked up then just a second, and I'm sort of at the shed at the end of the garden. It's quite a nice shed, to be honest, but at the end of the garden, right? And I looked to my right. My daughter is about to turn 17. She's just out there in a bikini. It's like about 15 degrees out there. She claims the UV is at some level. I don't know what she said. Yeah, quite an experience. Anyway, good stuff. I hope that was useful. Technically, that's halfway, though. That is the big chunk, if I could put it that way. I've just been passed a note, actually, and I'm to give a shout-out to... and I'm going to have a look into it. Oh, there we go. Okay, so it's Lodge Park, which I think you... Are you guys in... I want to say Cambridgeshire, Northamptonshire. Is it... I might be wrong. I think it's in Corby, but I might have you wrong. Anyway, if I've got the wrong school, guys, forgive me. But I'm just having a look. Oh, those photos are lovely. So thank you very much on X for sending those in. What I would say about the photo, which I won't put up because there's a few youngsters on it, what I would say about it is there's quite a few people kind of quite keen not to be shown. So hello, you lot. It's really good to see you, and thank you for taking part in the session. I hope those pastel highlighters in the image that you shared there and the Butterkiss popcorn are serving you well. So I really appreciate that. We got a bit of a question as well, which has been passed over to me, which is, are we going to cover chronic injuries? And the answer to that is no, not in this session, but I did cover those in the January 2024 session. So rather than going over them here, I would encourage you to go and do all your epicondylitis, your tennis elbow, your golfer's elbow, your ITBS, all that stuff. Do have a look at the 2024 sessions, or indeed the website where we've got the entire course, obviously. So, but it's there and available to you. And that goes the same with, let me get this right, Extrinsic Factors, which is another really big topic area. Again, that was covered in January 2024, so it is worth your while having a bit of a look at that. Other than that, I don't think we've got any further questions, unless I'm missing something. So what we'll do is, I think we've probably got in the region of about 20 minutes of content to go, something like that, so we'll definitely be out of here in good time. So we've got, in the region of 20 minutes to go. So I'll go back to the canvas, and obviously we'll touch base again at the end for a little chit chat, and I'll get my head down and take you through this next section. We're going to jump into reducing, mitigating risk, basically. So let's have a little go at it. Here we go. Just bear with me as I transfer onto the other. I always get a bit twitchy at this point. Here we go. Change of microphone, change back to the canvas. Digital pen in hand. Here we go. Okay, back to it. Okay, so just a couple of sort of strategies to reduce injury. So these are some things. Medicals, we might involve sort of medical considerations. So what might this be?
We might monitor blood pressure. This is done by something called a sphygmomanometer. I'm not going to put it in, but you've all had it done at the doctors or the nurses. I'm also going to say we might monitor cholesterol for an individual, for example. The other thing we might do is if we're doing some kind of training program for someone, we might undertake a GP referral, which is asking that person to see a doctor to make sure that they are well enough to go through the training that we are going to recommend to them. Other things, when we talk about screening, we are talking about previous health, checking, has this person ever experienced anything which is going to be preventative or potentially risky of this person? And the classic example of this is the PAR-Q, and this is called the Physical Activity Readiness Questionnaire. Okay, I hate the word questionnaire, it's really hard to spell in it. Questionnaire. There we go. Okay, so physical activity readiness questionnaire. And to be clear, this asks about health and previous health conditions. It's not asking lifestyle, for example. It's asking about the previous health conditions of diabetes, of heart conditions, of musculoskeletal issues, for example. Now, we also want to think about NGB policies. Now, these can be really, really significant given the example, but one of the things that people must follow the guidelines. You know, if we're talking about lifting in the line out in rugby, if we're talking about how many spotters there are in trampoline, I actually put that one in there. So, for example, number of spotters in trampolining. Now, I haven't coached trampolining for a while. I did my level 2 way back in the day. But when I was last coaching trampolining, it was at least 4 spotters and a coach, so 5 people. So a minimum trampoline session was 6 people, for example. So that was an interesting one to think about. What about British gymnastics, for example? How to support vaults. You know, like what hand holds to use, where to stand, which part, you know, it's not just about the safety of that. Think about that this here involves putting hands on sometimes young people, which, you know, there's actually a child protection issue there as well, and a safeguarding issue. You know, I've done loads, oh God, this is going to sound dodgy. I've done loads and loads of gymnastics teaching and coaching my time, trampoline teaching and coaching the time, and sometimes you have to hold someone's hand in a particular way to help them do that front somersault, for example. You need to make sure there's permission for that, and so on and so on. Other examples, guidance on javelin lessons. And there's this organisation, they're called the Association for PE, and they do publish guidelines on the way this should be done in PE lessons. AFP, what an organisation. No comment. Anyway, recovery position, straight back to you. So recovery position, what I want to sort of stress here is when you would do this. Okay, so you would position a person into the recovery position if they are unconscious. Okay, so that is when this is done. But it's critical, this person obviously needs to be breathing and unconscious. If not, obviously this is where sort of CPR and what have you, Dr. ABC is going to be perhaps more relevant. Now, the other time we want a recovery position is when there are no other life-threatening conditions. Now look out for this in the question, because the question you get may ask you to differentiate when you would and wouldn't put a person into the recovery position. Now I'm not going to get into the position with you. Just a couple of things that we're saying is it must be a stable position. The head must be to the side. The head supported. Okay, so things like this, obviously the head to the side is important because of anything that comes from the mouth, vomit, for example. That's a really, really important point in there. Okay, I'm going to move on from there quickly. Section 8, psychological effects of dealing with injury and medical conditions. Okay, so folks, this is quite an interesting topic because, you know, there's different things to be thinking about here. I just want to go, let me make this a little bit bigger. I just want to go through the different conditions or the different factors we might want to be considering. Mental rehearsal and or imagery. Practicing a skill or a movement in your mind, imagining a performance being successful. So we are practicing, we're being successful, it is skill-based. Now again, I just want to repeat the concept here. Your subconscious, you know, that sort of deep brain happens without you being aware of it. It does not know the difference between your reality and imagined reality. So when you guys do this, it is as if your subconscious has been there and done it and succeeded. That matters. Why? because it increases confidence when performing a skill in training or competition. It improves execution. Also, it helps us to manage stress really well and worry and anxiety and negative thoughts. Now, selective attention, let's be really clear with what we mean by this. This is ignoring irrelevant stimuli, focusing on performance, I'm going to say cues, not in the snooker sense, performance cues, things that the cues around you that actually impact what you're going to do. That's what we mean. We selectively attend. Now, this is part of information processing. Selective attention is also a really well-studied model. It's closely associated with arousal levels, for example. We've got Easterbrook's theory of cue utilization. We've got all kinds of different hypotheses about this, but the basic method is this. Is that the position of your teammates, say your opponents, say the ball, the shuttle, or whatever, the puck, say that influences your performance. Therefore, you should attend to it. If it doesn't, such as noise from the external environment, the colour of the walls, a criticism that a fan might be shouting your way, these things do not affect the performance of the skill. Therefore, they are ignored. Now, that is a skill, by the way, and it's actually a perceptual skill. But anyway, let's get on for that. What will it do? It will increase concentration. It will increase focus, and this is the point I really want to get to. You will find best or optimal performance, coming back to the inverted U theory, inverted U. You find optimal arousal levels in that setting. By the way, one of the symptoms of under-arousal and over-arousal is that we are poor at selective attention. One of them is being massively over-aroused. It's called hypervigilance, where we miss lots and lots of relevant performance cues and we focus on something that's less meaningful or just on one thing, such as an opponent. Okay, using injury time for other processes. So this one's an interesting one. So imagine that someone's injured. We might be talking about this person experiencing mental rehearsal. We might be talking about this person seeing sports psychologist. We might see this person, for example, becoming more knowledgeable about sports psychology, about understanding the mind. What is going to be the impact of this on performance? We're going to probably have a calmer performer once they return, and we might have less psychological impact of the injury. So someone who is injured, it might not speed up their recovery, we can't claim that, but what it might mean is that when they do return from, let's say, a fractured ankle, they're more confident in what they're about to do. Okay, we're getting really close here, folks. I want to talk to you about diabetes. Now, pretty much everything's on the screen here. Again, I'm just going to zoom in a little bit just to give you a bit of extra clarity here. So I just want to differentiate type 1 and type 2 diabetes. So type 2 often occurs in young people. It is whole life diabetes. It is so is this actually once it occurs, but this is something that's uncontrollable. So normally develops during childhood. My little brother Adam, he developed it when he was 7. Bless him, I'll never forget it. Lifestyle has no impact on the occurrence of this type 1. What is it? It's probably a genetic disorder. It means the pancreas is inefficient or it doesn't produce things like insulin effective. Remember, insulin is important because it helps glucose to enter cells, therefore it reduces your blood glucose levels, and as a result we have too little or no insulin that needs to be taken artificially and extragenously, so outside of the body. Okay, so we've also got here what might happen with someone who's experiencing type 1 for the first time. By the way, massive quantities of liquid. They'll urinate, including the bed, very tired, extreme weight loss. They don't heal cuts, and they'll be deeply dehydrated, okay? What's the treatment? Insulin shots, glucose if blood levels drop too low. That would be called hypoglycemia. Lifestyle changes such as diet, more protein in the diet, for example, and exercise. Now, type 2 diabetes is a different condition. This is what we might call lifestyle diabetes, okay? Normally develops later in life. Lifestyle, poor diet and sedentary lifestyle can cause it. Body doesn't produce enough insulin once it happens. Insulin does not work properly. So effectively, we can't get glucose out of the blood and into the cells, including to be stored in the liver as glycogen. And as a result, we get these symptoms once again. Differentiating type 1 and type 2 is a good practice for you guys to be able to do. Okay, quick change of canvas. Okay, let's once again zoom in a little bit and make ourselves a little bit clearer here. We're talking about other medical conditions. Our title up there, you see, is other medical conditions: hypothermia, heat exhaustion, dehydration. So I want to talk about hypothermia. This is temperature below. Hypo means less than or below. So we're talking here what would cause it: prolonged exposure to cold and wet conditions. This is a really interesting one. Obviously, cold conditions are bad long term, but if you get into cold water, it's particularly dramatically causing of hypothermia. Someone falling into cold water, let's say the sea, a river, or whatever. Ongoing exposure to cold air, this is going to be an issue. Clothes becoming wet in cold environments. I read once an article that polar explorers, the biggest risk they have is sweating, because once they sweat, that moisture is going to freeze, and that is going to cause problems. Anyway, I'm not going to get into it. And it's when the body temperature falls below 35 degrees. Remember, your body temperature aims to be 37 degrees Celsius plus or minus 1 degree Celsius. So 36, 38, these are all sort of healthy temperatures. 35 is low, below that is really low. Okay, what might we think? Well, the muscular system autonomically cause you to shiver and create heat, blue lips, pale cold skin, slurred speech, tiredness, confusion, slow breathing. All those are symptoms of hypothermia. What might we do? Get that wet clothing off them. Certainly in between, a scene is jumping out of my mind here. Wrap in blankets, obviously, for warmth. Cover the head, a lot of heat loss there. Move them indoors. Warm sugary drink. No alcohol. Keep them awake, stay with them. Okay, so lots of things. You guys need to learn that clearly. What about heat exhaustion? Or by the way, you absolutely can call it hyper over greater than thermia, heat. Okay, what are we talking about? Strenuous activity, lack of fluids, wrong clothing or choice in hot conditions. Obviously, we're talking here above 38 degrees would be considered hyperthermia. What are the symptoms? Sweating. If you're a clammy man like me, you don't need this condition for that. Pale, clammy skin, interestingly. Headache, loss of fluids. Dizziness, loss of fluids. Extreme thirst. That's an interesting one, because there are actually different types of dehydration. I'm not going to get into it here, but there's two different types of dehydration. One's called hyponatremia, one's called hypernatremia, and only one of them causes thirst. Interesting. That's for another day. Feeling sick or vomiting, rapid pulse, rapid breathing, cramping legs, arms, stomach. Okay, so there's your symptoms. Look out for them. What would we do? Well, we want to get people cooled down, obviously. Cool the skin, ice pack, ice towel, especially around the necks, under the armpits. Around the neck, you get a lot of blood flow at the surface of the neck, a lot of blood flow below the arms as well. Lie down and raise the feet. This helps venous return blood get back to the heart more effectively. Stay with people, and we're looking for people to have cooled down within half an hour. If not, they're going to need medical treatment. May well do anyway. And finally, guys, dehydration. There's loads going on here. I can do whole lessons on. I've got whole playlists on dehydration, but that's not for now. So, what would be the causes? Well, we mentioned diabetes a moment ago. Vomiting, we lose a lot of fluid here. Heart stroke, heat stroke. Again, that's that hyper. It's not funny. It's that hyperthermia we talked about earlier. Too much alcohol. Obviously, alcohol is a diuretic, and it restricts I'm not going to get into biology. Excessive sweating. Me on a dance floor. But like lots and lots of loss of fluid. Let's say running in humid conditions. High body temperature, obviously. Taking diuretics. This is a masking drug. So diuretics are a masking drug. So someone who's taken other drugs may mask them with diuretics. But the other thing it does is it reduces water in the body, and therefore it is really good for making weight. Now, I'm not encouraging this, but a judo player, a boxer, a jockey may be tempted to use diuretics because an MMA fight, because it brings water levels down the body and reduces body weight. Now, of course, that's good if you've got to get on the scales and be a certain weight. It's not good if you want a healthy body. And of course, loss of bodily fluid. So what are the symptoms? Thirst, again, sometimes. Fatigue, dark yellow pee. Okay, we often talk about the concentration of wee, or smelling of it, but it's not just how much wee. The other thing is to think about the amount of wee. I was actually doing some work on this recently. The amount of pee that you actually produce. If it's low, that's indicative of more dehydrated conditions. And of course, what we're talking about here is, like a stronger, darker colour here. Infrequent urination. There you go. There's my amount 4 times a day. And dry mouth and lips and dizziness. Now, what are we going to do? Drink fluids. What are our options? Well, obviously, water is an option. But remember that when we're dehydrated, it's not only water loss we might be experiencing. It might be electrolyte concentration as well. So we might want to be thinking about things like hypertonics. These are drinks that have additional electrolytes in it, or isotonics, which have got enough electrolytes to match average body conditions. So there are different options, and we've got rehydration sachets, which I'm imagining some of you teenagers after a Friday night out might have experienced here and there. Who knows? Maybe I'm judging. Maybe I'm being harsh. What a session, folks. Went quick. Well, it did for me. You probably hated it. Cheers.
Wow, that was a lot of information in one go. Like I said just now, I don't know what it's like for you. That's done me in. I'm ready for a sleep. Yeah, hope that was useful, folks. Yeah, a lot of information. I think one of the subtleties you need to be aware of with that session, perhaps watching it back and those sort of things, is I'm trying to explain every single point. I'm trying to get that kind of how, why, through which process, examples, through every point that's either on the notes, on the screen, I'm writing in. And that's really where you're going to differentiate yourself in this particular exam paper. Everyone can name the characteristics of this, that, and the other. But who can explain why it's like that, the impact of that, the examples that that can lead to? That's a different skill set, and is one that will differentiate you, which is why we encourage you to obviously take these sessions and look at it like that. Can I remind you, we've also published exam infographics for R180. Now, these are based on the sample assessment materials, but will give you a really good indication of the types of exams. For you teachers out there, can I also stress to you, we now have 5 full papers available. Obviously, you can construct them and deconstruct them any way you want to through Exam Simulator on the platform. So getting your students practicing question has never, ever been easy. Get them onto that and get them an experience of actually practicing some questions. We write them non-stop. So we are writing all the time additional exam materials. So just to be clear on that, we currently have 5 times more than OCR themselves have produced. So that is something that you can sort of make the most of, and we do a hell of a lot of analysis to bring that work to you. So if that's useful to you, then we encourage you to do that. Also, to teachers out there, I just want to make a comment that this is not the only session we're doing in this exam series. For example, tomorrow I'm live today, what's the date? 7th of May. Tomorrow on the 8th of May, we've got AQA GCCP and EdXL GCCP from 3 o'clock till 4:30 and 4:30 till 6 respectively, where we'll be doing an equivalent session, that time on components of fitness and levers and training principles and all that kind of stuff. So, we're looking at that material as well. If you've got A-level classes, NCFE courses, if you've got BTEC courses, we're offering exam unit preparation for those as well, both at level 2 and level 3. So hopefully that's fulfilling some requirements. And guys, can I just repeat again, we are putting this material out completely freely, and therefore we'd really encourage you to support us by putting a subscribe on the YouTube channel and hitting like on the video. That makes a massive. If you haven't liked the video, guys, please do that now, because that really genuinely makes a difference to us. So I'd really, really appreciate it if you guys would consider that. Okay, let me just check that I've not been passed any notes nor been asked anything further. I don't believe I have. Mentioned the Team Lodge Park guys earlier. Good. Thank you for those comments earlier, guys. I really appreciate it. And to the teacher that did that, thank you very much. I assume it was a teacher. And what we'll do here is I will play a little bit of outro music, and then I will wish you a wonderful Tuesday. What's on TV tonight? I'm going to the gym, and then I'm going to say it might be men's Champions League semi-final. Dortmund, is it? Not sure. Got a feeling there's some. Is there any playoffs on tonight? Bit of a football fan, especially this time of year. It's a good time to be a football fan, isn't it? Okay, here we go, folks. A little bit of outro music. Thank you for being here. We appreciate it. We appreciate you, and we wish you the most wonderful of afternoons and evenings. Take care.